Hello, everyone. My name is Matthew, and I will be presenting on genetic contributors of efficacy and adverse metabolic effects of chlorthalidone in African Americans from the Genetics of Hypertension Associated Treatment Study, or GenHAT study for short. Hypertension is a leading factor to cardiovascular disease. Hypertension refers to elevated blood pressure. So keeping an effective blood pressure is essential to reducing the chance of having a cardiovascular disease. Maintaining a good blood pressure is important from previous studies that show that using antihypertensive treatments on lower blood pressure leads to a decrease of having a stroke, heart failure, or constricted blood vessels. And this reduces the chance of death to cardiovascular disease by about 27%. Blood pressure control is very important in African Americans because of earlier and more prevalent onset of hypertension compared to people of European ancestry. So the article refers to Black and white populations in the US by African American and European American, this being a callback to the ancestry of these populations to obviously Africa and Europe, respectively. So compared to EA or European Americans, African Americans have a low response to beta blockers, angiotensin converting enzyme inhibitors, or angiotensin receptor blockers. So beta blockers block the androgenic beta receptors. And these beta receptors actually are the site for binding between adrenaline and norepinephrine hormones that are released by the sympathetic nervous system, which controls your fight and flight response. And so blocking these receptors stop the spike in blood pressure and closing of blood vessels to prepare you for fight or flight responses. However, African Americans have shown to respond better to thiazide diuretics and calcium channel blockers. Thiazide diuretics refer to treatment for how the kidney absorbs and reabsorbs sodium. And this is important because when this blocks reabsorption of sodium, it allows more of sodium to be filtered through urine. And this will reduce blood pressure because less sodium means a lower blood pressure because naturally it would actually increase your blood pressure. Calcium channel blockers obviously will block calcium from coming into the blood. And this will lead to vasodilation or relaxing of the blood vessels, allowing them to be wider and for blood pressure to be lower because blood can move more freely. Now, the purpose of this experiment is to examine African American responses to antihypertensive treatment. And this is important for precision-based studies for clinicians, policymakers, and health systems for public health. These are health professionals who want to raise public health in the US. And so looking at how we can support the African American population will be nice for raising health standards and giving a more inclusive environment for all patients. African Americans have actually historically been underrepresented in pharmacogenetic studies of antihypertensive treatment, and a large amount of genome-wide association studies, or GWAS treatment, has not been undertaken with African Americans. It's usually European Americans that are studied most widely. And so data from the genetics of hypertension associated treatments wants to identify genetic variation in these antihypertensive efficacy of chlorthalidone, which helps lower blood pressure by focusing on chloride ions, which would raise blood pressure by making it more acidic. For about 4,297 African American participants, plus another 320 that will be explored later, over a half annual period, or 6 months. Researchers also consider how genetic variation can present itself in fasting glucose, or your glucose about 4 to 6 hours after eating, to chlorothalidone heightening of glucose levels, again, from that acidity and needing more energy. So the methods that they went through is we had 75, 93 participants in total that were randomized to chlorthalidone, amitriptyline, lisinopril, and doxycycline. So that 4,297 participants were assigned to chlorthalidone. Those are the main ones we'll be looking at. But then another 420 participants are treatment naive. They never received treatment for hypertension. They are used for sensitivity studies because they have a higher tolerance because they've never been exposed to these medications. Now, chlorthalidone was given daily over the course of the study, and they were given decreasing doses of the drug. They started on 25 at the start of the study, and over time, we would go down by about 2 every day, at our halfway point being 12.5, and eventually 6 for another 2-month period. By the end, 3,982 participants had baseline and 6-month blood pressure measures. This would be blood pressure that's below 140 millimeters of mercury for systolic blood pressure, and below 90 for diastolic blood pressure. Systolic refers to pressure in the arteries, while diastolic refers to contractions of the heart. Do you know why genotyping was performed using multi-ethnic AMR, AFR B chip arrays, which look for banding patterns in genes? And in total, we found 967,857 variants that were used for imputation. So we put in different gene variants into coding, and we imputed them into different think of PCR tests. And they're analyzed from strand, concordance, position, and allele assignments. Some of these variants would look at mainly AG and CT mixtures. For example, one variant would be GG compared to a single A variant, because you're looking at base pairs. And so the genetic epidemiology of responses to antihypertensives, or GERA, and the pharmacogenomic evaluation of antihypertensive responses studies, or PAIR, looked at participants that were randomized to chlorthalidone and hydrochlorothiazide, as they both respond to chloride ions, and they helped influence the GenHAT study. So it was a washout period of at least 4 weeks to establish hypertensive blood pressure before starting the drug treatments. We had them take no medication. We monitored where their blood pressure was naturally, and they made them comparable to the secondary treatment-naive population. Now, Republican significance was tested at alpha 0.025 divided by the number of significant independent signals. So that alpha refers to the significance of the study. How important is this study statistically? How likely is it from variation? And suggestive variants were tested at 0.05 divided by the number of independent suggestive signals. 0.05 is the cutoff for most statistical tests, whether this is significant, whether this is due to variance. And so here's some graphs and data to better understand. As you can see, it was predominantly female, with almost 56% of them being female. The average was an age of 66, some being 7 years older, some 7 years younger. BMI could range from 24 to 36. And GenHAT participants saw a reduction of nearly 6.7 milliliters of mercury for their systolic blood pressure, that's SBP, and 3.1 milligrams of mercury for DBP, which is diastolic blood pressure, over the 6-month period. For FG, fasting glucose, there was an average increase of 6.7 milligrams over liters over 24 months, 2 years. For the subset of treatment-naive participants, there were larger responses because they're being, introduced to medications they had no interaction with before. So we had a major decrease, almost 20 for systolic and almost 10 for diastolic. However, there was an increase in fasting glucose by almost 10 milligrams per liter. And for table 3 represents the top 14 variants associated with the chlorthalidone blood pressure response. 4 of these variants meet the statistical significance criteria after correction. So this is seeing if that alpha is both above or below 0.05. Unfavorable correction is a type of statistical test. And so, as you can see from the table, AG and GA were the most important ones because they show intronic location. This is obviously focused on introns, but how these introns influence introducing of these genes. And then GA was intergenic, which is between different genes. GC and AG for the T-span and linking one are a little bit less prevalent, but they're just as important because they are also statistically significant. Now, the GG genotype carries on average observed a reduction of 6.79 milliliters of mercury over 6 months compared to an increase in blood pressure with the carriers of the A effect allele. And this is showing that CDHR2 compared to the linking one. And then persons homozygous for the effects allele G observed a 4.19 milliliters of mercury reduction in blood pressure compared to 2.52 milligrams of mercury reduction observed in those for A. And so these tables are showing the primary discovery analysis for blood pressure responses. That red line is showing the cutoff for genome-wide significance, which is below about 5 times 10 to the negative 8, which is below, which again is based on that alpha. And then these graphs that you're seeing are actually looking at the different variants, the top about 21 variants. And so from the results, we see 2 intergenetic variants located downstream of FZD1 were marginally associated with a diastolic blood pressure response. 3 variants were played with an intron of the CACNA1C intronic variant, and then 19 suggestive intronic variants of LTB-P1 in treatment-naive systolic blood pressure response analysis. There is marginal replication of this in the peer study for 4 of these variants with the same direction of effect, and 4 variants had marginal association with the change in diastolic blood pressure in the intergenetic region between CYSLTR2 and FNDC3A for the treatment-naive participants. And this will be very important for understanding how people who don't have interaction with hypertension, with anti-hypertensive treatments, might respond based on these 2 genes. And so we can see genetic variants associated with the blood pressure response. Chlorthalidone might help with treatment outcomes, as there are certain variants that are a lot more responsive to how this drug focuses on those chloride ions. And there are actually 8 significant variants associated with blood pressure response and 9 significant variants associated with fasting glucose response. And particularly, I wanted to focus on 3 significant variants in CAC and A1C, because this has been involved in several physiological processes, including vascular and smooth muscle contraction, and important blood pressure regulation, because it's been shown for how it might affect someone who develops cardiovascular disease, hypertension, as well as if they are more likely to get stroke or even a blood clot in their arteries and vessels. Thank you so much for watching the presentation. Yeah.